Hello, everyone. On today's episode of Women Talk, we are going to be talking about all things menopause. Did you know that menopause transition often involves troublesome symptoms, including vaginal dryness, painful sex, and urination, decreased libido, insomnia, and anxiety? And although many women are experiencing these symptoms, few are talking about them. Today, we're going to have a candid conversation on when women should talk to their healthcare providers about menopause symptoms, how to talk openly about the physical and the emotional impact that these symptoms have on women, and what treatment options are available. To help us learn more about this topic, we welcome Shawana S. Moore, who's a board certified women's health nurse practitioner who specializes in providing women's and gender related care throughout the lifespan. She is also the chair of the National Association of Nurse Practitioners in Women's Health and has served as the director of Women's Health Gender Related Nurse Practitioner Program at the Jefferson College of Nursing. Welcome, Dr. Moore.
Thank you so much, Beth, for having me.
And we are also going to welcome Dr. Tamika Roberts, who's an obstetrician and a gynecologist in Birmingham, Alabama, specializing in female reproductive health, menopause, breast health, and much more. Welcome, ladies, to Women Talk. We are going to dive right into all things menopause.
Wonderful, wonderful.
Dr. Roberts, I'm going to kick it off with you. Let's start off with defining what menopause is. And is there a certain age that women will experience or begin menopause? Is there that one number that's going to click into menopause?
Yes. So we all wish it was that easy as a click, right?
Right.
So menopause is defined as 1 year without having a cycle. So, but that could be hard to gauge if you've had a hysterectomy. And so if you've had a hysterectomy, of course, you're not having a cycle. So when did menopause start? So unfortunately, it might be a harder question to answer if you don't have a uterus anymore. So the magic number is around 52. So that's when we think we have completed menopause. But menopause is a gradual kind of process. So it can be over 10 years for some, or it might be 6 months or not at all. They might not have any symptoms. But the actual definition is 1 year without a cycle.
1 year. Okay, great to know. And I'm just hoping that it's not going to be 10 years for me.
Yes.
Dr. Moore, when we talk about menopause, we're hearing more and more about vasomotor symptoms. Can you explain what vasomotor symptoms are and what are some of the common menopause symptoms?
Sure. I just want to go back because you gave a really good statistics, but I want to add some data behind it.
Awesome.
So we know about 74% of menopausal women experience symptoms, but only about 7% actually seek treatment with the healthcare providers. So it's so important to have these crucial conversations around menopause to normalize it so that people can go and address their menopause symptoms. So when we think about vasomotor symptoms, those consist of hot flashes. So that's the sudden sensation of heat. It can be felt on your chest, neck, or your face, and also night sweats. So women will report waking up feeling soaking wet. And it can happen not only during the night, it can happen during the day as well. So the classic symptoms are those vasomotor symptoms, so those hot flashes and night sweats. Also, you mentioned earlier the vaginal dryness as well as pain during intercourse.
Right.
And also some other symptoms that are related to menopause, but sometimes women may not linked it to menopause. That could include trouble with sleeping, memory loss, and trouble concentrating, as well as depression, and also some joint pain can all be associated with menopause.
That's so important to know. So can the hot flashes start before menopause? Because I'm just asking, like during perimenopause,
Absolutely.
People in their 40s, like late 40s.
So remember, it's that perimenopause transitional phase, which occurs 7 to 8 years before the onset of menopause. So absolutely, that can occur.
Great. Thank you so much, Dr. Moore. And Dr. Roberts, Another term that we're hearing more and more about is GSM, or genitourinary syndrome of menopause. Can you tell us what this is?
Yes, yes. So that is a term which relates to vaginal atrophy. You may have heard that term before in the past. And so this is a condition where the lack of estrogen down in the area, the urethra, the vagina, the vulva, it starts getting affected by the lack of estrogen. And so people start having vaginal dryness, pain with intercourse, sometimes bleeding from it, um, urinary tract infections more frequently, urinary urgency, incontinence. And so the lack of estrogen can start affecting the organs down there.
Great. What about treatment options for this? Are there treatment options for this, for GSM?
Yes, absolutely. And so I love what Dr. Moore said about people not asking about it. And because there's so many people affected from the vasomotor symptoms to the vaginal atrophy. And so there are so many things out there that can help, from natural elements in the sense of lubrication or moisturizers, to vaginal hormones that can help the tissue become more pliable. And so to mechanical things, lasers and things like that. So there is a wealth of information out there, or treatments, and so you don't have to have dryness and suffer.
So then it is important, if you're experiencing some of these symptoms, to have the conversation with your healthcare provider, because there are some treatment options that are available to help you. Dr. Moore, did you want to add anything else to that before I go on to the next question?
No, I think Dr. Roberts covered it nicely.
Perfect. So Dr. Moore, how do the symptoms impact women's lives, both physically for activities such as exercise and sex, as well as mentally and emotionally? And can these symptoms be managed?
I think that's such a critical question. When you think about a patient, we always try to have a holistic approach, right? Mind, body, spirit.
Mm-hmm.
So they have a multifaceted of impacts, right? So physically, women may be reluctant to engage in sexual activity because it can be very painful, right? That can lead to trouble within their sexual relationship with their partner, right? Women may not be able to exercise because they may be a fear of having vaginal tears because, again, as Dr. Roberts mentioned earlier, that vaginal atrophy, meaning that vaginal tissue is very thin. Also, when you think about emotionally and mentally, this topic is sometimes shamed in communities where people don't accept it as a normal part of the aging process, or I should say the growing wise process, because women, we don't age, we just grow wiser.
I love that.
Yes, you make it as a positive, but normalizing those discussions so people aren't ashamed of them and they do seek care, because it can be it can be a lonely journey that can increase women's rates of depression and anxiety related to having the symptoms. But as Dr. Roberts mentioned, there are lots of ways to manage symptoms related to menopause. Mm-hmm. Estrogen alone could be one. If a person is status post hysterectomy, meaning that they don't have a uterus present, you can have estrogen and progesterone. Those are for specifically patients who do have an intact uterus. Also, bioidentical hormone therapy. That is the normal hormones that we naturally make in our body. I think the most important thing is to making sure it's regulated and FDA approved, which your healthcare provider would know that. And again, it can come in oral preparations, topical preparations in a form of a patch, as well as topical gels or sprays. And you have vaginal preparations that can be a ring, it could be a tablet, or it can be cream. So there are multifaceted of treatment options, as well as antidepressants, which include SSRIs. So if you can't have hormones for some reason, there are alternative treatments that you can use that don't contain hormones.
So I love hearing that there's some advancements in this area. And it's just, again, so important for women that are starting to go through or in menopause right now to know that they can talk to their healthcare provider, and there are options out there to help them. Dr. Roberts, how are you able to talk to your patients about some of the GMS symptoms successfully? And what tips can you provide to our audience on how to begin the conversation, as some of these symptoms we have been discussing can be a little bit embarrassing or sometimes even difficult to bring up? What's your advice?
Yes. So, when people come in, I try to make it as welcoming as I can, because to see a gynecologist is always nerve-wracking. I mean, you can just be coming in for test results. You always worry we're going to get you undressed, right? So it's having a good relationship with your patients in the sense of asking that question. So, I want to put it on the doctor or the healthcare provider to get that information, because you never know what is going on in your patient's mind in the sense of how they feel about the symptoms that they're having, or if they're having any symptoms at all. So as a provider, we have to ask the question. I know we're busy sometimes. You're just here for your well-woman visit, but if we ask the questions, like for me, I ask, are we having any trouble down there? Starting off very gentle, very general. Okay, they don't open up. All right. So then my next question is, are you having sex? Sometimes they get embarrassed. Sometimes they don't. Sometimes I get TMI, too much information. But that's what I'm here for. That's what gynecologists are here for. And so, okay, so if we are, is it painful? So I'm asking those questions. But, everybody can't come see me. Everybody can't see Dr. Moore. And so if you want to take charge of your own health, have your questions written down, ask to speak to your doctor privately, because sometimes people don't want to ask in front of your MA or another nurse, and say, hey, can I get 1 second of time? I need to ask a private question. And for you to take care of your own health is very key. So write down those questions and just ask, can I have some privacy? I just need a second to ask this question.
I love it. And Dr. Moore, is there anything that you do a little bit differently too in your practice to get women to kind of open up a little bit about some of the symptoms?
So I think Dr. Roberts hit it right on. I think a lot of it relies on the provider creating a safe space for patients, right? We have to create the environment that makes our patients feel comfortable to be able to give us such personal information, right? I think the biggest thing is understanding from a patient perspective is you are a vital role of your healthcare. You are considered a member of that team, and your voice is just as valuable as us as healthcare providers. So really recognizing that and understanding that is essential. And the other thing is, along with making your list, have clear goals and expectations with your provider. I think that is essential. And just to know that you're a part of the team and your contribution is needed so that you can have the best health outcomes and management of your healthcare needs.
I love it. I completely agree that team approach is so important these days, because we can't go in thinking that our healthcare provider is going to have the answers to everything when we're not even there to help guide and provide some of the signs and symptoms that we're experiencing. So it's a two-way street. So ladies, as you're listening to this, talk to your healthcare provider. They're there to help you. They listen, write down your questions. There are treatment options that are available to help you through midlife and beyond. And it's just understanding where you're at right now. And it's a team approach. So I love all of that. Thank you so much. So now we're going to take some questions from our audience during our Q&A. So great. So Eden, so Dr. Moore, I'm going to start off with you. What is the earliest age you may experience menopause symptoms?
It's a great question. So it can be anywhere. I won't say a specific age, but I'll say it can be anywhere between 8 to 10 years before you actually hit menopause. So I would say maybe early 40s, 42, 43 for some patients, but averagely 8 to 10 years before the onset of actual menopause.
Great.
And sometimes, do you mind?
Please do. Absolutely.
And sometimes we see them at the end of the 30s, your late 30s. Because a lot of people come in the late 30s saying, oh, I'm having hot flash, but it's too early for this, or I'm not sleeping well, it's too early for this.
Right.
And of course, we do blood tests. You're not in menopause. You're having a cycle every month. You're not in menopause. Right. But especially in African-American women, we can see it a lot earlier. Sometimes as early as 10 years to 12 years ahead of time. As African-Americans, we can get it a longer period of time, and it can be more severe.
Okay, that's great to know. So ladies, you're not losing your mind.
Right.
Right? It's just go in, again, having that conversation about some of the symptoms you're experiencing, maybe get a blood test to see where your hormone levels are, and then figuring out a game plan. Yes. So Emily writes in, how long do women typically experience menopause symptoms?
So I think that's a great question. And Dr. Roberts hit on a piece of it in terms of race and ethnicity. So your genetic makeup has a lot to do with how and when you experience menopause. So we know genetically, Black women tend to have a longer period of that perimenopausal phase, as well as more severe symptoms. Also, Asian women and Latino women tend to have early onset of menopause when compared to white women. So I think the biggest thing is understanding that it is genetically linked as well, and there are differences depending on your race and ethnicity.
So then my question is, so if you can talk to your mom and find out, like, what does that connection or correlation have, like your family history, will that kind of provide maybe some guidance on when you might be going through, you might experience menopause symptoms or go through menopause based on your mom or your aunts?
Sure. So it's so funny. So when I was training as a nurse practitioner, I learned from my preceptors, which was a mixture of physicians as well as nurse practitioners. You always ask the question of, when did your mother go through menopause? So immediately I'm like, as a student, I know, okay, so it's genetically linked, because that's the question that you ask your patients.
Right.
When did your mother go through? Do you have sisters? If so, when did they go through? Because they counsel patients to know that if this is when your mother went through, this is when your grandmother went through, this is when your sister went through, this is likely when you'll go through. So yes, you do want to have conversations with your mother, her mother if possible, and your siblings that are a female gender.
Great. Good.
I know. I feel so sad for those who say, "Oh, well, my mom's still going through those symptoms, and she's 65." I'm like, "Oh,
oh no." All right, let's go on to the next question. Oh Lord. Okay, so Sherry writes in, what blood panels should I be asking for if I had this partial hysterectomy? I still have my ovaries. So Dr. Roberts, do you want to take that one?
Sure. So a partial hysterectomy, which is layman terms, meaning the uterus is gone and has been surgically removed, and she still has her ovaries, which I assume are still functioning. I'm not sure what age range she's in. And so if we are talking about just menopausal age range, which is around 52, then estrogen, we will want to check your progesterone level. Also, we can check your FSH and LH. So the FSH and LH will let us know about if you are in menopause by certain levels. Now, it doesn't tell us everything, because sometimes we can have a normal FSH and still be going through perimenopausal symptoms. And so that's when the estrogen and progesterone come into play to see what the levels are.
Great. Thank you so much. Next question. Mo writes in, when does normal cognition and memory return? Most of my friends blame COVID, but COVID plus premenopause or perimenopause is not a great combination for memory at work and life. Who wants to, do you both want to tackle that one? Dr. Moore, you want to kick it off?
I think it's a combination of when you can have the symptoms related to menopause managed with appropriate, if the patient is a candidate for hormonal therapy, having that estrogen may help support that cognitive function being returned. Dr. Roberts, I'm not sure if there's more you want to add, but it's a little complex.
It is a complex question, unfortunately, because there's a lot of things that can affect your cognition and your memory. And so it will be a team effort between us and your primary care doctor, depending on what range you're in. Especially with COVID, it definitely has complicated things because it can affect those things. And so if you've had COVID and you're having memory issues and you're around menopausal time range, then it's a combination team between your primary care and us to determine. Now, I love what Dr. Morris said about hormone replacement, because some ladies, if they're candidates, then I get them started on that. And if they don't see any improvement, then we can say maybe it is COVID. We need to go that direction. Or if they don't see any improvement, something else could be going on. And so I sometimes start off with that to make them at least feel better for the other symptoms they may be having.
No, and I also think stress and anxiety. I mean, this past 2 years has placed such an enormous stress and I'm going to just selfishly say a lot on women, right? Because we've had to manage not only, dealing with COVID, but dealing with our families during COVID. So I think on top of going through perimenopause and COVID and the stress, I think that can just absolutely impact your cognitive function.
Yes.
Yeah.
Absolutely.
And Jessica writes in, how do you know if it's menopause or something else?
So you can go, Dr. Robert.
Yes. So, and the something else, that's when it's definitely important for you to see your primary care or your gynecologist, your nurse practitioner, because we can run those tests to see if we are in menopause or not, especially if you've had hysterectomy. We talked earlier about it's hard to tell when you've had hysterectomy. Get that question all day, every day. Am I in menopause? But I don't have a hysterectomy. How do I know? And so getting those blood tests could be key to finding that out.
Great advice. Dr. Moore, did you want to add anything else? I feel like these questions are awesome for both of you. So I'm going to have you both weigh in.
I think Dr. Roberts hit it. I'm like,
I do too.
Important to see your healthcare provider. And again, it could be an interdisciplinary approach.
Perfect. Thank you so much. And what's our next question? How will I know if I'm menopause, if I'm still using great question. If I'm still using birth control. So if I'm still using birth controls, how will I know if I'm going through menopause? Dr. Moore, you want to take that one?
Sure. I usually tell patients I wouldn't know because we have hormones that are artificially managing your hormone level. So I don't know unless you stop the pill.
Yes, that's a hard question.
Yeah, you only know if you stop.
Yeah, it's very hard because if you're on birth control, it does affect your hormone levels. So I can't simply do a hormone level on you if you are on birth control pills. And so a lot of ladies like, well, I don't want to get off because I don't want to get pregnant, and I definitely get that. And so I usually wait till age 54 to 55. And then we have that discussion about coming off of it, without fears of getting pregnant. But then it's a deeper conversation about how long your mom went through menopause when they were still having cycles. And that gives me kind of a range to talk about coming off birth control pills.
Great input. Great question too. And then Amber asks, I've gained a significant amount of weight since entering perimenopause. Diet and exercise doesn't seem to help. Any advice on how to kick up your metabolism during this transition? Who wants to tackle?
Isn't that always the hard question? I always tell us as women, we have to be gentle with ourselves because genetically, as we get wiser in age, our ability to burn fat is a little harder. As we go through that perimenopausal phase, we make less estrogen, which is not the best thing because that doesn't allow us to burn our fat as we usually would. So I think that's the harder question. But what I would probably say, if you were a candidate for hormone replacement therapy, having an estrogen on board may help with that. Diet and exercise is one thing. It sounds like that's not beneficial. I guess my answer to that would be hormone replacement therapy if you were a candidate for it. Potentially having consultations with nutrition as well. That could be helpful too. Also making sure there's not an underlying endocrine condition that may be leading to the excessive weight gain or inability to lose weight as well.
Right. And I did want to add with the exercise, make sure it is strength training in the sense of building up your muscle mass. Because that we are, as we go through menopause, our muscle mass decreases. As Dr. Moore said, our metabolism starts going down. And so that's going to be a key thing with the exercise. Cardio, but you have to put some weights in there.
Weights are great for keeping your bone mass up as well too.
Absolutely.
Right?
Absolutely.
No, all such good advice. And I know we've already talked a little bit about the hysterectomy and the ovaries. And Dr. Roberts, you shared that it's important to get the blood test if you still have your ovaries. And that's going to be a big indicator on where you're at with going through perimenopause or menopause. So a question I had as I'm thinking about this, and unfortunately, I've had a couple friends that have just recently been diagnosed with cancer. When do you both start counseling your patients that are going to start going through cancer treatment regarding, the symptoms of menopause and menopause management after that? Because so many women end up going through surgical menopause or get thrown into menopause because of chemotherapy treatments.
Right.
So when do you normally start counseling her on how her body is going to change?
Right. Well, hopefully, if they have a fantastic oncologist that helps tackle all of that. So when they come and see me, sometimes they already know some of their barriers or some of the things they can use. And so we kind of go over that, and I'll tell them my recommendation on what I think can help with whatever symptom that they're having. And for them to contact the oncologist to make sure it's okay. Because there are certain things that are out there, like vaginal estrogen, that we can use in cancer patients, even some breast cancer patients, that help with some of their vaginal atrophy or vaginal dryness issues. But, that can be kind of scary to hear about, I can use vaginal estrogen, but I've had breast cancer. And so I don't want them to feel like I said one thing and oncologist has said another thing. So it is hopefully a coexisting relationship with the oncologist. I'll give them a call and say, hey, I would love for them to try this. What are your thoughts? Because I don't want the patient to feel in the middle of making that decision.
That's such great information, Dr. Roberts. So it's really, again, going back to what Dr. Moore kicked us off with, that team approach, right? Mm-hmm. So as you're talking to your oncologist, it's important, ladies, that you ask them these questions about, going through menopause, if your treatment will actually trigger menopause, or if it's going to be surgically induced, because if it is, it's going to be a team approach, not only with the oncologist, but with your OBGYN or your nurse practitioner that's taking such great care of you. So great information. So I think we're actually need to wrap up now. And I want to thank you both for your time and your amazing energy in today's conversation on Women Talk. For our next episode of Women Talk, we're going to be talking about COVID and the long haul on September 26th at 12 p.m. And this episode of Women Talk was made possible with the support of Allura. Thank you both, Dr. Roberts and Dr. Moore, for taking time out of your busy schedule and joining me on Women Talk. I'll see you next time.
All right. Thank you.
Thank you so much.